So the Mahsa Alliance group of physicians, Mahsa essentially stands for Medical Alliance of Health Service Abroad. And it's really a group of allied health professionals. It's doctors, nurses, dentists, therapists, the entire spectrum of healthcare that's outside the country of Iran, and are all interested to use their expertise to help with those that are injured and are affected by the recent protests that have taken place since the death of Mahsa Amini in September of 2022. And so initially, the idea was to bring together a group of experts to address the immediate needs of physical injury and trauma that was taking place on the streets. And so the concern was, how do we respond to people that are injured but are not able to actually go to a hospital or go to a clinic because they're really being picked up and arrested on the spot rather than being addressed. So at that time, the idea was to have a number that people can easily call, and that's through some of the social media channels. So we sort of put together this has all happened, by the way, just in the past 2 months, since late September, when we were able to get together. And so the idea was to put together a Instagram that can provide immediate, quick information. Let's say if you have an eye injury, what's the first thing that you do when you have an eye injury? If you have a shotgun blast that unfortunately a lot of these kids are getting on the streets, what do you do with these, the pellets? If they go under the skin, do you have to remove them? How do you wash them out? So there's that immediate addressing of the physical injury, and then the sort of the post-math. What do you do sort of long term? That's really how this started, but it has taken a turn now in that there is now longer term. Now we're into the third month of these protests, and number one, a lot of the patients are actually being treated at home. So we have patients, unfortunately, these are teenagers that have been paralyzed, for example, from gunshot wounds, and they're not able to get to the hospital. And by virtue of being in bed, now they're getting bed sores. So now for example, we're treating bed sores, right? So we're going to that chronic phase. And then there is mental health challenges. There are many children who have been arrested and were interrogated. And obviously, it's very difficult to sort of elicit a good history because a lot of them are silenced, whether through intimidation or just the trauma of having undergone an arrest and interrogation, where the children are not really responsive, they're not speaking to their parents. So we've had a number of teenagers who have reached out wanting to speak, but really not knowing how to do it. And of course, so that area with the mental health specialists within our group and Mahsa has really become strengthened, and there's a lot more activity happening on that end because it's a very difficult thing to speak about. There's a lot of stigma associated with talking about, what's happened to them when they were imprisoned. And I think unfortunately, that's only going to rise. And then there's a sort of another wave that's happening in the past week or so, which is a lot of the students at the universities, and they're reporting being poisoned. Whether that poisoning is happening upon their arrest or it's happening at the university, it is thought that some of it is actually may have happened at the university from the food that they've been served. So you have this other wave of potential toxicity that's happening, that it's a lot harder to elucidate and treat because you really don't know what the agent is. So that gives you sort of a general perspective in terms of the initial call to come together to address this. And then in the midst of having sort of looked at the data of what's happening, and a lot of our colleagues that are physicians in Iran, they also reported to us that they're not able to actually, a couple of things. One is the physicians are not able to take care of the patients. There are physicians who have been arrested for managing patients that are actually physicians who have been injured as a result of wanting to help patients. And that's actually against Geneva Convention rights and not allowing an injured patient to get to health, to basic access to medical health. So as a result of that, our group actually wrote a letter of concern to WHO, to World Health Organization. And then, so that was about a month ago. And then there was a number of injuries with children, where children not only have been killed, but those that have been injured have not been able to make it to see even a basic assessment by a pediatrician. So those are the reports that we have received. And so we wrote another letter of petition to UNICEF, because UNICEF actually has a chapter in Iran. They have a number of offices in Iran. So they have more of an access with the government officials. And so that petition, particularly, I believe now, that was done about a week ago, and we have over 50,000 co-signers on that. And we're hoping to get more attention. So I think another aspect of this is to try to bring awareness through, as a group of concerned doctors and nurses and health allied professionals, to be able to bring a global concern to issues that should be addressed when it comes to, medical and mental health. Yeah, I think there's really three prongs to be able to assist. I know there's so many concerned Iranians abroad, whether in the United States or other countries, that have a real interest to help, the country of Iran, and also those that have been affected inside the country. So, I think within that paradigm, you have, number one, obviously, anyone in the health allied services, be it physicians, nurses, dentists, psychotherapists, because we really need to bring together experts from around the world that have a real interest, and to be able to create protocols that we can help with those that are injured and cannot have access to their basic healthcare needs. Hopefully, this will get resolved and that will happen, but on an immediate basis, I think it's important to increase the group of interested health allied professionals to come together. So number one, please join us. I think that's the simplest thing, to please join us, because the more brains we have, the more diverse opinions that we can put together, the better it's going to serve us. And as I mentioned earlier, there's an immediate need with regards to addressing the immediate healthcare needs, and then there's going to be long care needs, the least of which is going to be the post-traumatic stress disorder of a lot of the unfortunately injured young youth and others that have been affected by these protests. So I think that's going to be an ongoing issue. And then we have some of these newer phenomena that are developing. We may need to have some toxicologists, for example, to be able to help us understand why some of these kids are getting injured outside of once they've been released. Why is that happening? Why is this phenomenon ongoing? So I think number one is bringing together a group of experts in the field. Number two is to provide awareness, which is to, what you're doing, which is helping bring the word out, and to be able to share that not only with Iranian Americans or Iranians abroad, but actually with native North Americans and Europeans and Australians and Africans and so forth. So I think it's important for the world to be aware of what's happening in this country. And I think we've seen examples of, like, for example, when people learned about the apartheid in South Africa and the world came together, how you can create change. Well, we're dealing with a country that's really has exercised gender apartheid for the past few decades. And I think that globally we need to create change. And then last but not least is to create a organization around this. We as doctors, all we know is best is medicine. But I think at some point we need to come together, for example, with our colleagues that are lawyers. One of the things that we're looking at with Mahsa is to document the injuries by the Istanbul Protocol. And the Istanbul Protocol is a validated system that's been endorsed globally by all countries to be able to document injuries on patients when it happens, so that when you and I look at this record, be it today or 10 years from now, we know exactly what the situation was, and we can hold the people accountable for that injury. So I think it's very important to start documenting these events and to be able to have that documentation, because it is part of history that we need to make sure we accurately record and come back to in the future. Well, I mean, I think that, listen, I mean, you need to sort of put pressure on the current government so that either happens through, global organizations and governments that are actually doing business with the country of Iran, the Islamic Republic of Iran, or non-governmental organizations that actually are actively playing a role with the country. So, for example, WHO has been very involved, especially with COVID, with what's been happening with Iran. So there is an integration and communication between the two sides. So the issue, I think, for a lot of us that are outside the country is that we don't have a direct way of being able to create change, right? Change is happening on the street by a lot of the brave men and women on the streets that are protesting. But at the end of the day, it really needs to happen at a higher level. And so as non-political physicians, we have a role to play within the healthcare community through these organizations, be it WHO or Physicians for Peace or some of the other organizations that are sort of globally involved. We're also having a discussion with Doctors Without Borders. So these are a lot of the well-established, decades-long organizations that really understand what's happening on the ground and can potentially influence what happens on the ground. So that's why we're reaching out to them. Of course, that also needs to be sort of in parallel, needs to happen with people who understand the political organization and the levers of politics, but that's not really what we do as physicians. So that's why we're really engaged with the NGO side. My wish is for everyone who has the passion and the interest to get engaged. We're actually interested, even as early as medical students, to engage with us, to help us with some of our writing, outreach, and so forth. And then with the non-medical community to really spread the word and to sort of help organizationally to help us with things that, we're not trained to do. We're trained to take care of patients. But of course, like any other organization, we need help. And, like a sister organization like PAAIA, for example, you guys understand how to do outreach and sort of affect change on that end. So that's why it's helpful to have this conversation, and many others that I can't think of now, but I'm sure there are many out there that are doing very similar things that are effective. We're available, as a group of volunteer physicians, we're available and we're engaged. And so we're hoping to be part of this process. It's a huge process and it's going to require a lot of different stakeholders in this, but at least we hope to play our part.